evening.
I was waiting for you.
I was waiting for me. Oh. You know, my wife normally try to play this trick on me sometime when you go up in the Caribbean, you know, to say good evening, good afternoon, good night.
Yes.
She consistently reminds me the word is good
evening.
evening. So you want to say good evening. You know, she's a stickler for those English and those. So I try to keep myself in order lest I get rebuked by my sister. Keep myself in order. So welcome to Intimate Moments.
Yes.
I tell you, tonight will be absolutely fabulous. I'm telling you. I want you. Let me tell you. I want you to go and share the link now.
Yes.
Go on our YouTube channel, Intimate Moments, and our Facebook page for many people who are joining our Intimate Moments page and our YouTube channel. And I want you to press the bell, and you could share the link because we are information highway tonight. Information highway as we look. You know what I mean? Let me, before we go, Babes, how was your day, man? How was your day?
It was good. It was a good day.
Did you miss the man? Did you miss the man? Stop laughing. Did you miss the man? I miss you, know that.
For a
right?
while,
You see, I called it today and
Yes.
I came down a little early.
Yes.
You know why I came down early?
Why did you
You
come
had
up?
biscuit there, you had juice in the fridge in your
you had my
office.
stuff to come and eat out,
Right, so but that wasn't the only reason. You know?
That wasn't the only reason.
No, that wasn't the only reason. It was a lot of reasons, but that was not the only reason.
Okay.
All right?
But you were fed.
But I was fed both ways. All right, let's go back to the story. Right, so tonight we have with us for the very first time. I am so excited. You know, today I was wondering because it had troubled me a while ago being pastor in a church and seeing so many things happening when it comes to this COVID-19 and the impact. As you know, for the past year, 2 years, 2 years, we have been out of the church physically, and they were just recently going back into the church.
Yeah.
And there are so many people who are not even coming out to the church because of the stigmas and what they have been hearing.
Yes, the fear of the COVID, yeah.
So that took today, it kind of really, this morning when I was in work, it kind of hit me a little hard. And, you know, I was wondering, I say, wow. I mean, we had a lot of people come and talk about this thing before, not on this platform, because tonight is the very first time that we are literally on this platform talking about this issue.
Yeah,
you
like
understand me?
this,
Normally,
yeah.
because I know Intimate Moments is really about marriage and relationship issues and family development, and health is also part of family development. So we
That's
don't,
right.
you know what I mean? And we say one moment of intimacy with God will change
change
your
your
life
life
forever.
forever.
And health is one of the heartbeat of God. So we need not to miss this. We must understand this. Very significant. So tonight is a great pleasure and honor to have for the very first time. And I will tell you something. It's the very first time that we actually having somebody of this accolade on our program. When I mean accolade, meaning it within
You
the...
mean caliber?
Well, yeah, caliber. That is the word I use.
Yes. Somebody of such high esteem.
Right, on our program. I mean, we
Right.
have people, we're talking about from a governmental
yes,
standpoint,
yes.
you know what I mean? So it's our great pleasure and privilege to introduce for the very first time Dr. Faith B. Israel. She
yes.
is the Secretary of Health, I have the wellness
and social protection.
So,
yes.
good night, Dr. Faith. How are you?
I am good. Good evening. It is an honor being here. Thank you so much for inviting me. And let's talk. Let's have fun. Let's, share the information because this is all important.
Yes. So it's such a joy to. So, Dr. Faith, I know you're now in you just get into the office. So before we get into how it is to you, you know what I mean, and we see you on the campaign train, we see you before always talking about the health issues. How it for you in your office? Just share with the public. How are you? You know what I mean? How it's the new office? You're adjusting to this new challenge.
Well, it is certainly a challenge. But it is not a challenge that is insurmountable. I am actually enjoying it. I keep telling, I'm talking to my parents and other people and telling them, yes, I'm tired. Yes, I'm getting up earlier than I want to. Yes, I've become the person who sends a message to my staff at 5 a.m. I have become that person.
Wow.
But I am really enjoying the process so far. And I think that God has put me in this place because he is there to guide me and to provide the kind of knowledge and courage and strength and everything that it takes to treat with this. So it is challenging, but I'm excited about it.
Wow. Yeah, we really appreciate that so much, Dr. Faith. And as you use the word challenge, one of the things that even within our church world, because we want to address this issue from a church perspective and try to alleviate the fear and that people might have and the concern that they have. We really want to deal with this because just this evening we were traveling in the car, and one of the things that we heard on the news, we had about 4 deaths in Tobago. There were just 4 deaths in Tobago, and overall in the country having, I think, about 17 today. And the deaths are climbing, and they are climbing, and so we want you to speak, first of all, in your capacity, specifically to Tobago. You know what I mean? How is the situation in Tobago? I heard you said sometime ago it is grim. I want you to zero into that and bring it home to us for those who don't really probably grasp what you actually were saying.
Yeah, so for quite some time, as a matter of fact, probably for all of this year, the situation in Tobago has actually been worse than the situation in Trinidad. When you look at the sheer numbers, the number of people who've been getting infected, the number of people who've been dying, unfortunately, have almost been double in Tobago compared to Trinidad. And I know when we look at the numbers and we say, well, it's only 4, but it's 4 out of 60,000. And when you do the maths, compare that to, the 17 out of 1 point something million, you're seeing where it may seem like just 4, but when you look at the statistics, it's really, really huge. It's really a big issue. And it's one of the reasons why I kind of hit the ground running. So even though I officially got my instruments of appointment on Friday, from the time we won the election, we realized we won Monday night. By Tuesday morning, I had already started working, already started calling people, trying to get a sense of what is really happening on the ground. Because my philosophy is, you can't fix a problem if you don't understand what it is. So I've actually been spending the last the 2 weeks or so, trying to figure out what really is the problem, looking at solutions, looking at how we could implement the solutions in Tobago given our limited resources. And by the way, the resources are limited. But we could do it. I think if we think about it differently, if we open our minds and strategize and think outside of the box, we could do it. I think that we could do it.
Wow, that is good. I love what you said. I know you talk about resources being limited, but I love what you said, that we can do it. We can do it, and that is so important. That so some of the, could you explain to us? I know my wife will have several questions. Could you explain to us the importance of following the protocols, those protocols that have been given to us to help us deal with this
the
COVID pandemic?
Sure. So let me step back a little bit. Let's talk about exactly what is COVID-19 and what causes COVID-19. So COVID-19 is coronavirus disease 19 because it was discovered in 2019. It's not because there was a 1, 2, 3 or anything like that. It just has to do with the year it was discovered. And the virus that causes COVID-19 is called SARS-CoV-2, severe acute respiratory syndrome, coronavirus /2. Now that is important, the 2 part. Well, the whole name is important. Let me start with the beginning. I'm not sure if you remember 2003, 4, 5, and a couple years ago, we started hearing about SARS, and we started hearing about SARS coming out of China and that kind of thing. So it really is a brother or a sister to that virus from way, way, way back when. And it's important for us to remember that because a part of the issue of late is people are saying that, this virus came out of nowhere and we just started studying it, when in fact we didn't just start studying it. we've been studying a version of it since way back when we were dealing with SARS. Of course, coronavirus and -2, meaning this is kind of like the second version of it. So that's a virus that is encapsulated with a protein membrane, meaning the genetic material, which is the heart and life in essence of the virus, is inside a protein shell, right? Now, that is important to understand because the protein shell is actually a very fragile thing. The thing that causes the protein shell to mash up and wash away is soap and water. The water actually goes into the protein shell, the soap gets into the protein shell and separates it, so it is no longer there. And if the protein shell is not there, then the virus cannot survive. So that's why we are telling you, wash your hands with soap and water, or use the alcohol-based hand sanitizer, because the alcohol in the hand sanitizer does the same thing to the protein shell. So I know it is annoying every time you go into a building, they point you to the sink, wash your hands, sanitize, but that is why we're asking you to do it, because whatever virus may have been on your hand, you can easily wash it away down the sink. So that's one thing. The other thing is to wear your mask. And I see people wearing their mask here with their nose, with their nose outside. Why are we telling you to wear your mask? I don't know if you have ever been close to somebody who, when they're talking, does spelt boulders.
Yes,
You know, the mouth water that come out. Yeah, man, yeah.
Wow,
So
wow.
the person not sneezing, the person not coughing, but just regular talk, and you're feeling the boulders hitting you. So the virus is actually inside what we call boulders. It is inside the liquid that is in your mouth, inside the liquid that is in your nose. So the fact that just talking causes it to come out means that if the person has COVID-19, there is virus in their mouth and in their nose that can come out. So the reason we ask you to wear the mask is so that just in case you have it, there is an additional layer there that prevents the virus from going out.
Wow.
The reason we tell you to social distance is because, let's just say you don't have on a mask, for example, or you sneeze or cough and the boulders are flying. Because they are actually heavy, meaning they are heavy particles, they actually fall to the floor after a while. Like anything else, gravity takes hold and they fall to the floor. And we've recognized through quite a number of studies that when the distance between it coming out of your mouth, coming out of your nose, and falling to the floor, usually by the time you get to 6 feet, it has already fallen. So it's no longer in the air coming to you, it's already on the ground.
So it's
and that is why we tell you this. Yeah, so it's on the ground, it's not coming at you in the air. And that is why we tell you to social distance.
No,
we tell you to stay.
Sorry, I don't want to disturb you, but you know, as you said that it comes to the ground, because you know sometimes somebody sneeze and you get the impression that it's still in the atmosphere, they're circulating for quite some time before it falls. How long would you say it would take after you sneeze for it to actually hit the floor?
So it depends on when you sneeze or when you cough, there are different size particles of the boulders. The heavier ones, the bigger ones fall quickly. The lighter ones take a little bit of time to fall. I can't remember exactly how long they would say it stays in the air, but it actually is not a long time. So let's just say somebody sneezes and an hour later you come by, it's still circulating in the air. It's not that long. Within a relatively short period, it actually does float. It does fall to the floor. But that is a very good question. Now, the difference is, for example, and I'm glad you raised that point. Let's just say somebody sneezes or coughs. They did not have on the mask. They did not cover their mouth or nose, but they are right in front of a door handle. and it gets on the door handle, and then you come right after and touch the door handle, so it's now on your hand. And then we are human beings who touch our face, touch our nose, touch our mouth, so what was on the door handle is now on your hand, and it's now in your eyes, in your nose, in your mouth, and there you could get infected. The other thing we are begging people to do is, if you are sick, please stay home. And I know that is hard, considering so many people have economic issues. They can't afford to stay home. But we've also recognized that at the time when you are exhibiting symptoms, so the time when you're sneezing and coughing and runny nose and all of those things, that is actually the time where you are most infectious. So when you have those symptoms and you go to work, it means you are now exposing everybody who is at work to the virus at that time, versus waiting a little bit, getting better, and now that you don't have symptoms. When you don't have symptoms, you are less likely to transmit the virus to other people.
Oh, so wow. So I want us to start Zoom, because I love the platform that you set, that one can understand what the virus is and how it's actually transmitted. So what would account, would you say, in your own research, what would account for the hesitant or the fear of being vaccinated?
So several things, Again, a lot of people don't understand what vaccines are. And let me give you an example. I did a session with Pastor Baines in his area. This was, before the election. He just had a little health fair in the Black Rock area. And there was a lady who came there, and she was adamant she's not getting the jab. She doesn't want the jab. It's bad. She's not getting the vaccine. And then I asked her, do you have children? Yes. Have your children been immunized? Yes, of course my children have been immunized. And then I told her, but the immunization, even though it's a different word, is the same thing as vaccination. And she kind of pulled back and was like, so the jab is immunization. So we are accustomed to talk about the immunization card. So I think the language that we've been using is a little different. People are not used to it. A lot of people got out there quickly with misinformation. Misinformation that if you did not have a solid base in terms of a biology base, you may get carried away. Now, for example, I saw the video of the guy who said he got the vaccine and then he put the bulb against his hand and the bulb lit up. And I said to myself when I saw that, this is the dumbest thing ever. This guy is just being foolish. We don't even have to respond to that. Until I was traveling in a car and somebody asked me about it. Because they saw it and they thought that it was true. So, things like this. And I don't think that we spent enough time explaining things to people so that we know why we are doing things, what we are doing, what is the purpose for doing it. Many of us did not go through our biology class. Many of us only got to a certain level. So you really don't even understand how vaccines work, to understand why we take the vaccine and why even if you take the vaccine, some people can still get sick and some people can even die because there is no vaccine, not even the ones we've been taking for decades, is 100% safe. Not safe. It's 100% efficacious, meaning you will never get the disease. Those are things that we did not take enough time to explain in the beginning, and because we didn't, a lot of people got the misinformation and ran with the misinformation.
But let me ask a question. How would you therefore qualify when you have some medical practitioners who might be, like I saw some of them on the internet, they have big conferences, and they also was pushing this agenda or pushing this other side that you're talking about that contribute to the misinformation or thing. How do you therefore reconcile those information to the unlearned like myself who have no biological background, who have no medical thing? You know what I mean? How do you speak to individuals like those when they listen to other people who are supposedly medical practitioners that are doing these things?
Well, it's the same way. For example, you have medical practitioners who would tell you, don't ever take a tablet that is given to you in the hospital, or don't do a particular surgery because of whatever reason. There are always going to be people with differing opinions about things. You also have to look at the actual source of the information that you are giving. Now, for example, there are people, I hear people say, for example, that they will not take the vaccine because it was not tested on, it wasn't tested on a lot of people. When in fact, if you read the data, you would realize that it was actually tested on hundreds of thousands of people. The Pfizer's phase three clinical trials was 50,000 people. Moderna, same thing. AstraZeneca, same thing. So when you add it up, over 100,000 people. But those same people would tell you that they are recommending that you take another medication, for example, that was only tested on 2,000 people. And they're telling you must take this because there is some data that shows that this is working, but you should not take the vaccine because the vaccine is not tested. When you actually look at the data from both studies, the vaccines have actually been tested on hundreds of thousands of people when the other thing was only tested on maybe 2 or 3,000. So if you're really looking at how many people it's been tested on, but that's the thing, most people, lay people, don't have this information and can't make that kind of informed decision. Now, the other thing that is critical, and it goes back to information, we also, because of this internet age, because of social media, because we are now all very connected, people had access to information about adverse events, for example. We started hearing the AstraZeneca caused blood clots and that kind of thing. People have access to information that they were not able to put into context again because of the lack of understanding of the issue. Now, this information has always been there. Every vaccine has had some kind of adverse event. Every medication, there are people who take insulin for diabetes, and the insulin kills them because there are people who have adverse events to insulin. But when you look at the number of people who get a very bad reaction to insulin versus the number of people who the insulin helps, you see why the medical world says, let us continue using insulin. And because we did not have that kind of foundation, that kind of contextual understanding of the information that we were being bombarded with, we ran with, oh my God, it gives you blood clots, or it does this, or it does that, not understanding the percentage, not understanding that, yes, this is actually quite normal. Yes, the people who had to experience it, we don't like that. Their families and so forth had to experience that loss or that pain. But this is quite a normal process as it relates to treating with medical technologies. And we were not able to put that into perspective.
Let me ask a question. In your own research, I know I can't say I don't know what the information that you have available to you in respect to religious bodies like churches. Why there is such a high resistance? I know there are some people who might have medical issues and they might be advised by their doctors not to pursue, not to go. That might be in one case. But from my own research, and even in being a pastor in church and you hear conversations, why there is such a high resistance within the religious world against vaccination?
Well, I don't know that I want to speak on behalf of organizations, maybe you should be answering that question. In terms of your members, what are the reasons they are giving for being hesitant? Is it that there was a narrative very early up about the vaccine being linked to, the mark of the beast, depending on what religious organization you are linked to? Or was it because you were taught that this is, something else? You know, the thing about religion generally, and this is not just a Christianity thing or any particular kind of religion, the thing about religion is that it really, really allows the believer to believe in things that are strange, that are unnatural, that are outside of what other people may think of as quote unquote normal. And therefore it is hard to say to a group of people that you are right for believing this or you are wrong for believing this, because that is what religion allows us to do, to believe in things that other people don't, and we hold it near and dear to our heart. So, it might be worth having the conversation with those within the various religious entities, to ask that question. What made you hold on to this particular doctrine about the vaccine? And what made you not hold on to a particular doctrine about it?
Yeah, one of the reasons I asked that question, I kind of the follow-up to that question is based on when you listen from the national reports, and you'll hear that the Prime Minister or the Minister of Health, they might tell those that when they found in the religious bodies that there are a high percentage of people who are COVID is occurring, and at the same time there's a high percentage of people not being vaccinated. And I'm looking at the stats that I'm seeing in Tobago. The stats that I'm seeing in Tobago is, and we just have a population, let's say about 59 to 60,000 people. And if you remove 10% of that, let me say 10% of that is the religious bodies, and you have 10% of that who are hesitant, maybe not all who are hesitant. What kind of step will your administration will want to do and want to encourage religious bodies, or by persuading them, it's time to get, because if we continue the way we are going, based on what you said a while in your press conference recently, what you said that it is bad. I don't know whether it's the correct word I'm using, but you kind of highlight how terrible the health system at this stage with COVID is. What would you want to say to religious people who might, yes, they might have their religious belief?
I wouldn't even say just religious persons, because I think it's like a wide variety of persons who are holding on to this.
But I'm asking the question in context of seeing our population and what is happening, what the administration probably prepared to do to stem or to mitigate this.
So we have to do several things. I think one of the ways we failed nationally is with how we communicated with people. One, the information that is provided at these press conferences, these COVID media briefings, are not information to make anybody do anything. They are not convincing anybody to do anything. It is information that, as a health professional, I need to know. As a statistician, I need to know. As a Secretary of Health, I need to know. But for the man on the ground who's just trying to make his bread and butter, or her bread and butter, the information that's provided there is not critical, it's not important, and it is also done in a way that is not easily understood. I am sure, now I am a trained health educator. That is a big chunk of what my degree is in. And one of the things they taught us very early is that you have to be very careful about who your audience is, and tailor your message for your audience. And that takes into account the literacy rates of your audience. It takes into account their cultural beliefs. It takes into account their educational status. All of those things need to be taken into account. Now, for example, the Ministry of Health just started producing some information about Trinidad, and I'm not even sure if this is Ministry of Health. I saw this document and I realized it's not even Ministry of Health that does it. It says COVID-19 deaths as at November 15th, 2021. and there were a total of 1,000. This was November, 1,467 deaths, and of those, only 57 were vaccinated. And you actually saw they actually have little men representing each of those people, you know, and then you were able to see the 1,400 and something who died, who were unvaccinated, and then the little line down here of the vaccinated who died. And that is such a very clear image that anybody looking at it would realize, wait, it's really the unvaccinated people who died. Just looking at the visual, it didn't have a whole lot of words. It didn't have a whole. It was just,
It gives that impression.
the men. The men were in either blue or green, so you could quickly see the picture, and you could see that it had a whole lot of blue and one little line of green. So it goes back to how you communicate with people. I think that even if I think about myself, the best way to get me to not do something is to tell me I have to do it. just as a human being, I'm just rebellious by nature. So the fact that we had people coming to these press conferences and screaming at us, telling us we have to do this and we have to do that, and calling all kind of names and whatnot, was already turning off people who may have actually already gone and gotten their vaccine if we had just had a nice conversation and asked politely. So we have to, I think that is one of the things that we heard quite early, and it is one of the things I am going to ensure that I don't do. I am going to actually listen to people's concerns, answer their questions because they have real concerns, and I've already begun getting some decent results from just doing it that way instead of screaming at people.
Wow. But my wife have a question to ask.
Even as we're talking about, the vaccination hesitancy, I know one of the reasons that persons are unwilling to, and I think that I heard some information where they were saying that a lot of young men, were refusing to be vaccinated because they said it was making them sterile. I believe that persons were also saying that it could affect women from becoming pregnant and that kind of thing. I want you to speak to that. Because we remember the whole Nicki Minaj story that came out, that kind of thing. I want you to speak to that, because maybe as well it is misunderstanding of what the vaccine is and what it is what it's geared to do. You understand? I think so much of this information have been coming with persons saying stuff. As Trimbagonians, we have a way sometimes of saying things in jest, making joke about certain things, and then persons take it more seriously, and then all of a sudden it becomes truth when it really isn't. But I really want you to speak to that.
Yes, so it really is an unfortunate situation, because when you look at the data, we do have quite a relatively high rate of men, for example, who have erectile dysfunction issues. That has nothing to do with the vaccine. That had nothing to do with COVID. This was a situation from way back when. Coincidentally, these same men were very willing to take the Pfizer erectile dysfunction drug, but were not willing to take the same Pfizer, the Viagra. Many of them don't know that the Viagra that they run and get, the little blue pill, is made by the same Pfizer.
Wow.
Yes.
It's the same Pfizer. It's the same company.
That's right.
And on top of that, some of these are the same young men, for example, who would go into a bar and pick up a package of pills, the horny goat weed and the whatever. And when you look at the package, you literally have no idea what is in it, because it's not even in English. And they take it and you're like, okay, so really, what is your concern? What are you scared of? Because you are showing me that you are being reckless when it comes to these things that you just go in the bar and pick up and buy.
Mm-hmm.
And it relates to the same manhood issue, but it's because they didn't understand how the vaccines actually work and what they do and why they behave the way they behave. So maybe it is worth answering that question in this instance.
Yes, I have. No, I just want to, before you go ahead, as we have indicated, you can send your questions. If you have a question for Dr. Faith, you can send your questions. Ask a question and she will try as much as she can answer. She can answer your question. But I have a question from one of somebody who's hooked on Miss Spencer. I don't know if it's a Miss or Mrs. Spencer. The question is for Dr. Faith. What plans do we have to? What plans do we have to push COVID information into the schools? Maybe the young ones can help educate their parents.
That's a very, very good question. So yes, and we've actually seen some situations where the younger ones, the standard 4 and 5, and even the forms 4 and 5 were the ones that were giving their parents the accurate information about COVID-19 and about the vaccines. They were the ones who were saying, "Mommy, I go in and get my vaccine. I want my vaccine because, I just did it in biology." So I think we need to get more of that information out there. You are right. Some of it might actually be a little bit too technical for some of the younger ones, depending on what it is we are talking about. But remember, the other thing we have to also note that, and this is something I tell parents all the time, we are actually a country, Trinidad and Tobago, who has boasted on every single international record where we can boast about it, is a country that has some of our highest rates of childhood vaccinations. Listen, we have the 95 and the 98 and the 99% vaccination rates for practically every single childhood vaccine there is. But again, it goes back to us not even paying attention. And I keep telling them, when you had your baby, the 3-month clinic visits, that you dress up the baby nice, you took pride in putting on the baby clothes and took the baby to the clinic, and the doctor or the nurse gave the baby an injection and the baby came home crying, and they told you the baby would have been sick a little bit for the next 2 or 3 days because and little fever and the baby chronic and ting. That was vaccine. That was a vaccine. And we have some of the highest rates of vaccinations in the world. We boast about that because it's actually a measure of the goodness or the efficiency of our healthcare system. And most people don't even recognize that that is what they are taking their child to get. The fact that we have gotten to the ages that we've gotten to in many instances is because we have taken the vaccines. The fact that no one in Tobago can tell the last day somebody died of measles, or somebody died of polio, or somebody died of whooping cough, or somebody died of any of these things, is because we've all been vaccinated for those things as children. So we have a culture of vaccination. We just need to link what we're talking about now to what we have been doing with our children at the beginning.
I have another question, and I'm asking this because I see a lot of times when persons are having this conversation with regards to COVID and discussion with regards to vaccination, there's always a group of persons who talk about using natural stuff. I want you to speak to using the natural remedies as opposed to taking the vaccine.
Right. So maybe this is a point where I would actually speak about how the vaccines work. So our bodies have a part of the system, as I actually tell people that it's because I did tertiary education and I understand how the body works. That actually caused me to believe in this entity known as God even more than before, because the body is made up of these different systems that just work perfectly together. And one of those systems is our immune system. Now, how does the immune system work? The immune system is one that is there to protect us. It protects us from foreign entities. So if something is inside us, it sees that as it's part of me, it's okay, that's fine. If something comes from the outside and gets to the inside, the immune system has to do several things. One, identify that there's a foreign thing happening. There's a foreign thing there. Two, identify what the foreign thing is. Three, determine whether the foreign thing is good or harmful. And then four, build a response to the foreign thing. Okay, so that is what the immune system does in those steps. What the vaccines do is actually bypass or fast track many of those steps. So when we are putting the vaccine inside of you, it is putting a foreign thing inside of you. It is putting a foreign thing that the immune system will not recognize as something that is quote unquote bad for you. And it then builds the response to it. Now, part of the response includes building of antibodies and other parts of the immune system. Now, the good thing about our immune system is that once you have that first experience of treating with that foreign thing that we've recognized as bad, your body remembers it. And your body remembers how to treat with it. So if you come into contact with it again, your body doesn't have to go through those initial steps. It already has the thing to fight against it. And that is what the vaccines do. It allows your body to start making the antibodies and the other parts of your immune response that fights against the COVID-19 virus before you actually come in contact with the COVID-19 virus. Now, why is that important? Because this virus is a virus from hell. This virus, not like, and I am not going to get into the arguments about whether it is man-made or not man. It is a virus from hell, whatever it is. And the thing is, because it is such a dangerous virus, there are many of us who will come into contact with it and we will survive. But there's a large volume of us who will come into contact with it and will get so severely ill that we will die. Now, and what we are realizing now is that even those people who came into contact with it and survived, months and now up to a year, 2 years later, have not gotten back to normal yet. So yes, they survived. Yes, their immune system was able to fight it on its own, but they have not gotten back to normal just yet. And because of that, I have to ask people, are you really willing to take that chance? To take the chance to allow your body to fight on its own, and we're not sure which side of the coin you would fall? Or are you willing to use something that we know works that would give you a fighting chance? And when you look at the variants that are out there now, the Delta, for example, was more infectious, meaning while the original versions of the virus, if I had COVID in the room and there were 10 other people, I may have just infected 1 or 2 other people. With Delta, I am in the room, 10 other people, I'm infecting 4, 5, 6 people in the room. So more people are getting sick. The more people who get sick means the more people who are more likely to get very sick. The more people who are more likely to get very sick is the more people who are very likely to die. And then we go to this situation where we have now, where because we have more people who got sick, who got very sick, who now need medical care, our medical system now gets caught up in treating these people who have a severe illness. And that means we can't treat everything else that we've been needing to treat with. So that is why this is so important. That is why this is so critical. That is why you relying on your own immune response is not necessarily the wisest thing, because we don't know where your immune response will take you. And the other thing that we recognize is that the response that you build, for example, on your own is not as robust as the response that you build with the virus, with the vaccine. So the vaccine gives you a response to a particular part of the virus known as the spike protein. So it knows to look for that spike protein. The next time it comes into contact, you're looking for that spike protein. When you get immune on your own, it may not be to that spike protein. It may actually be to another part of the virus, and we are now seeing that the virus is mutating quickly, and the other part of the virus that is mutating. So you have a situation where you may have gotten immunity to one part of the virus, but the virus has now mutated, and when it comes back, it looks different. So your body does not recognize this as something it dealt with before. This is a brand new entity to you, and we've actually seen where people got reinfected because of that.
All right. One more question, Dr. Faith. I don't know my wife. This is from Miss Williams. She said, read it, my love.
She was asking, with regards to persons who have chronic diseases, she was asking if the healthcare practitioner should rule out the patient's medications via drug interactions before administering the COVID
vaccine. Right.
Yeah.
The fact remains that when you look at the data, the people who are more likely to get very sick and to die are the ones with chronic diseases if they get COVID-19. So that is why when we started getting the vaccines, we were actually saying to give it to the priority list, the people who we know if they get COVID are going to get, the result is not going to be great. Give them the vaccine first, and then those of us who are younger and healthy and that kind of thing, we could wait a little bit because our response seemed to not be as bad as those who are older and those who have chronic diseases. Now, the thing is, though, again, we go back to people being honest and people being realistic about what they do and how they do it. Most people, when you tell them to go check on their health, generally, they don't do it.
No.
They don't. They don't go to the doctor until they are sick and dying. Most of us. Most people, when they finally go to the doctor because they are diabetic or they are hypertensive, they are overweight, they are whatever, the doctor tells you you need to diet, you need to exercise, you need to eat right, you need to do all of these things. They don't do it. They don't do it. Why are you now asking the same health professionals who've been begging you for the last 20 years to diet and exercise and eat right and take care of yourself and so forth, and you have refused to do it? Why are you now asking those same health professionals to tell you to go do the things that they've been telling you to do for the last 20 years and you have not been doing it?
Wow.
And now you are upset that they are pushing the vaccines. Yes, we are pushing the vaccines because we've been begging you to do the other stuff for the last 20 years and you didn't. So that is why we have to push the vaccine now to try to save your life, because you now have the heart disease and the diabetes and the high blood pressure and those things.
Let me ask a question. Would it be in consideration by the THA, I don't know, to make vaccination mandatory, especially within the species of Tobago? That would be a part of the consideration? Because when, as I indicated a while ago, when you look at our numbers in Tobago, it is pretty high. And if you have about 60,000 people, and the amount of people every day, like today we had 4 deaths, is that a place you think that the administration in Tobago would want to make such a decision?
So that is actually a legislative thing that we don't have the power to make. So the Tobago House of Assembly does not have the authority to make a law like that for Tobago. Now, when we were talking about autonomy bill and that kind of stuff, those were some of the things that we were raising, that if Tobago wanted to do that separate from Trinidad, we should be able to. But currently, we do not have the authority to do anything like that outside of what the national government has legislated us to do. I would actually push back on mandatory vaccinations generally, because again, I think that if we provide the information in the right way, we can get people to get vaccinated up to a certain point without making it mandatory. And there are examples all over the world. One of the places that I would ask you to probably to go searching, New Zealand. New Zealand's Prime Minister, is it President, Jacinta Ardern. She's female, so maybe it's a female thing. They just boasted, yesterday or today, that they have reached 90% of the population who is eligible to be vaccinated has been vaccinated. They don't have any mandatory vaccinations or anything like that. And by the way, they started vaccinating people months after the rest of the world. And they've gotten to the 90% mark because they set up the system. If you look, because of the time difference, she has her press conferences every night or every other night in the middle of the night. And the way she speaks, the way she brings across the information, the way she answers the question, they've actually set it up so that they could get vaccinations all over the place. When they had lockdowns, for example, and again, this goes back to communication strategy. When they had lockdowns, they would actually say to people, so this is where we are. These are the numbers that we're having. If we do not get to a certain point by Monday, we will then have a phase 1 lockdown by Wednesday. That gave the business people, for example, some time to say, okay, we might get locked down by Wednesday. Let us, fry out all the chicken that we had because we might get locked down by Friday, by Wednesday. Unlike us where, Prime Minister, bless his heart, would come on TV and then he would say, by midnight tonight, everything is shut down. And everything is like,
midnight.
As of midnight tonight.
As of midnight. Like, what in the living? What are we doing? So again, it goes back to the communication strategy. And I think that is where we failed miserably, to be honest, in Trinidad and Tobago, as it relates to that.
Yeah, you see, I feel you because, as I said before, one of the concerns in Tobago, where a number of people are sick as well, and they don't go to the health care providers. They're not going to there at all. How, as you said, education, but there are a number of people who just, as they enter into the health system after they discover how unhealthy they were. For example, they receive COVID and they go inside, they realize they were diabetes.
Yes, persons who actually survived would have been then diagnosed as being diabetic. Persons are being diagnosed as hypertensive and a lot of these. And you see that, I like the fact that he brought that up, because one of my concerns, and I think is maybe something that I don't know if you could explain, because persons want to talk about taking natural remedies. My concern with regards to taking natural remedies is, who is monitoring you while you are taking the natural remedies? That's one of the concerns that I have. And I'm also looking at the fact that for a lot of the persons who are talking about taking natural remedies, they are in their 40s, in their 50s. Now, we would have been eating as we are accustomed eating all our meats. I mean, how many of us are actually eating as much vegetables as we should be, drinking as much water as we should be, exercising as we should be? But because we are walking around and everything seems to be okay, we think that we are healthy and that our body can cope with just maybe relying on natural stuff as opposed to taking the vaccine. And so that's been part of my concern. So I don't know if you could speak to that.
Yeah, and I could actually give you a perfect example. At that same event with Pastor Baines a couple months ago in Black Rock, I actually met a young man who was there who looked healthy, muscular, looked like if he goes to the gym all the time, looked healthy. And when we took his blood pressure, it was 200 and something over 100 and something.
Wow.
Yeah. Wow. And I looked at him and I thought, okay, so we need to get you up to the thing. And I'm like, so are you feeling anything? And then he started explaining, yes, he feels the tension behind his head and ting. And then I said to him, imagine. And then he was hesitant to take the vaccine as well. But I also said, but imagine a situation like that where he had taken the vaccine and then something happened, not relating to the vaccine, but relating to the fact that he has a blood pressure of 200 and something over 100 and something. And then the world will go crazy saying, you see, he took the vaccine and he died. And it's like, no, that had nothing to do with the vaccine. That had to do with the fact that this man had been telling, and he told me he's been feeling that pressure behind his head for months.
Wow.
And had not done anything about it. So we have to be so careful about, how we relate things, causation versus correlation kind of thing, and how we are linking the negative or adverse events of the vaccine to other things that may have no relation at all
Yeah.
to the vaccine, but because we really are generally unhealthy. And by the way, Trinidad and Tobago specifically does actually have some of the highest rates of diabetes, heart disease, high blood pressure. I mean, if you think about it, I'm sure you could quickly think of at least one or two or three people with diabetes close to you,
It's true.
Yeah.
even within your family.
Yeah.
And that is every single person on the island can think of one or two or three people with
That is pretty
diabetes, with
high.
heart disease. That is high. That is we
Yeah.
have some of the highest rates of that. So we have to be very, very careful. And that is why we needed the extra help, so that, if those people come into contact with COVID, their body already started priming and already started getting the antibodies to fight against the virus.
Wow, wow. So, Dr. Faith, you see, we all just having fun, having such powerful information, as you know what I mean, and we looking at our time is just going down. But before, this might be my last question. I know we are into the Christmas season, and everybody loves the Christmas. I know we can't celebrate Christmas how we normally will celebrate Christmas. I just wanted to speak and give some help, some health help tips. I don't know if I say it right, as to how
Health tips.
how we navigate our path so we will not be infected. We follow the protocol, so you could share with us, so people could go on living good lives but not being infected with what is happening because of what is happening in Tobago.
Right. So the reality is that, honestly, this year, as the young people that say, Christmas nothing this year, we kind of had to cancel Christmas this year, and we're canceling Christmas this year so that we'll be alive January 1. That is why
Wow.
we're canceling Christmas. Because Christmas is a time that we usually family gets together, and of course, families from different households get together. If we have a house, if one person with COVID from one household comes with a family get together, and you now have 20 people liming, drinking, not wearing the mask, you now have 20 people with COVID versus the one person who, if they had just stayed home, it would have just been them surviving. So these are the kinds of things we have to keep following, all of the protocols. We have to keep following all of them, to resist the urge to go online. Resist the urge to go and hang out with your friend. Resist the urge to go by people's house. Resist the urge to even. One of the things we recognize lately is that, even in the religious setting, you almost have to resist the urge to go in church.
Yeah.
Because if you think about it, we do several things while we are at church. Some of us cry, some of us scream, some of us sing at the top of our voices. All of those activities, if one person has COVID and is doing those activities, it means you are more likely to be spewing the virus into the building. And particularly if it's a closed building, if it's a building without proper ventilation, you now have 50 people in this building with this person who is singing praises. Yes. But because they're singing praises and singing at the top of their voices, the virus is now flying all over. And granny next door, Tante so and so, who happened to just be kneeling right next to you, now is sick because of it. So we really, really need to keep following the protocols. And I keep telling even the healthcare professionals, by the way, the healthcare professionals are having such a hard time because they have to go to work. They have to see it. They have to see the patient who is their neighbor who just died. And they have to get up tomorrow, put on back their scrubs and go back to work like normal. So when we are asking you to do this and to follow the protocols and to kind of cancel Christmas this year, it's because we really have a whole system that we are trying to protect, including your lives. Because if that system up there breaks down, and it is, when I tell you it is right there, then you who have your diabetes, or you who have the cancer, or you who have the whatever else, you wouldn't be able to get any care either, because the whole system has collapsed. And that is why we are saying, you need to follow the guidelines.
Dr. Faith, I'm telling you, it was such a pleasure having you tonight, especially the way in which you deliver the information, and one of the things that will stick in my mind is about education, educating people, bringing to the forefront that people need to know and just know the correct information that we can work and operate effectively, we can function well. And I said a while ago, we want to really congratulate you, you know what I mean? And for your first debut on Intimate Moments, we appreciate you. We'll call on you sometime again. You know what I mean? Your debut on Intimate Moments. We really appreciate you coming and really sharing the information and
as clearly. And I mean, persons on the live would have even responded that the information was clear. And that's one of these things, because I would have heard you speak to this, and I really found that you were really very clear, very open, very honest. You laid it all out and you spoke to it. And so I'm saying I would have heard it, so I was hoping that other persons would have heard, but sometimes people miss it. So it was good to have you on, so you could have shared that same information again, and also answer, one or two questions that persons would have been sharing, expressing that kind of thing, the concerns that they would have had.
So, Dr. Faith, thank you so much. You could just stay on the line while we go to wrap up the program. You stay on the line, all right? Stay on the line. Thank you so much. Oh my!
Thanks for having me.
Thank you. You're most welcome. Amen. So that is Dr. Faith B. Israel, the Secretary of Health and what again?
Health, wellness, and social protection.
So we want to appreciate her tonight, and for those who are the first time on Intimate Moments, if you're for the first time, remember to go and like our page. You go and like our page, go and like the page, and you can subscribe to our YouTube channel. There's so many information on relationship issues, marriage issues, a lot of stuff. You could
health issues, different things that we would have discussed.
So you could go and like the page, and you could subscribe to our YouTube channel. We are here every Thursday from 7:30. However, next Thursday we'll be having our Christmas program, so you can join us and be a part as we celebrate Christmas. So, as we normally say on Intimate Moments before we go, one moment of intimacy with God will change your life forever. Stay strong and God bless you.
God bless you.